Good morning and a very warm welcome on the occasion of World AIDS Day to this conference organised by HIV Outcomes on HIV 40 years on, time to focus now on health-related quality of life. My name is Jackie Davis. I will have the privilege of moderating our discussions as we explore what needs to be done to move beyond viral suppression to focus much more on health-related quality of life 40 years after HIV was first detected, and why this is so important. A couple of housekeeping notes before we get underway. If you want to ask a question to our panel or make a brief comment, you can do so in the chat function. Please use the chat function, but could I ask you please be as brief as possible so that I can see at a glance what your question is and who it is for. And the Twitter hashtag, if you would like to share what you are hearing at this event today, and we do encourage you to do so to get that message out about the importance of what we're talking about, please use the hashtag World AIDS Day. It's now my pleasure to give the floor to Frédéric Ries, MEP, member of the European Parliament's Committee on the Environment, Public Health and Food Safety, and co-host of today's event, and an HIV Outcomes champion, a sterling fighter for the cause. Frédéric, it is great to have you with us. Please, over to you for your opening thoughts and to get proceedings formally underway.
Good morning, Jackie. Hello, everyone. It is so great for me to be with you all to open together this year's World AIDS Day conference. I'm Frédéric Ries, as you mentioned. I'm a member of the European Parliament. I've been sitting on the Committee for Health and Environment for, well, let's say a few years now, actually more than 20. Before that, in a previous life, I was a journalist and anchor for one of Belgium's main TV channels, meaning that it is from the newsroom that I have first witnessed the rise and the tragedies of the AIDS epidemic. Since then, I have tried to keep the issue up on the political agenda for years, including, for instance, by tabling and getting our latest resolution of the EP on HIV adopted in 2017 to ask for the renewal of the European Action Plan on HIV, which actually ended the year before in 2016. This call at the time was not heard, but I remain determined to make the case for people living with HIV and their absolute right, as you mentioned, to enjoy the same quality of life as we all do. And it is with this particular intent in mind that I have co-hosted since 2018 this yearly World AIDS Day conference with you, with HIV Outcomes. And I want to thank you all for helping us bring this event to everybody once more, as well as all our guest speakers for their time and insight. I'm particularly proud to introduce this conference this year. As you mentioned, again, we mark the 40th year since the first time that AIDS was reported in the US, effectively starting a global epidemic that will go on claiming the lives of more than 30 million people globally as of today. So this day is a time to celebrate the progress achieved since the 80s in the fight against HIV, and it is also an occasion to reflect on the needs of the HIV population today. In my country, Belgium, it is estimated that 20,000 people live with the virus. Comforting news is that more than 4 out of every 5 diagnosed persons have achieved viral suppression, meaning that their treatment is successfully blocking the reproduction of the virus and preventing illness. But this should not make us complacent. While surviving the virus has become the norm in most of Europe, regaining a good quality of life still has not. And the other pandemic, COVID-19, has only made this matter more pressing. We know that its consequences have been especially felt among people living with HIV, whose generally poor mental health has worsened due to isolation and issues of double stigma, for instance. So this year's symbolic anniversary, I have a problem with the term, should therefore open a new chapter in the fight against HIV, one that puts patients and their well-being front and center. After all, we no longer live in the 80s. Our HIV policies should not either. So this is why today we should often draw attention to the policy actions needed for quality of life to become a new issue to measure progress against HIV, looking beyond viral suppression. To help inform this debate, I have the great pleasure to announce to you today that with the help of my colleagues from the Committee on the Environment and Health in the EP, the Parliament has just accepted my request to commission an in-depth study to compare and learn from the best policies addressing the long-term needs of the HIV community. This unprecedented study will help the HIV community champion the transformation of our health systems in Europe, an example of what the European Parliament can do to completely help the HIV community to live better. Proof again, that investing in the HIV community benefits everyone, and that we have a lot to learn from our experience with this global epidemic. The study should be no excuse for delay, though the time for action is now, as reflected by the title we have chosen for this event together. So in this spirit, we will be asking our guest speakers today about what can and what should be done now to improve the well-being of people living with the HIV. Starting with our first speaker, it is an honor for me to introduce Stella Kyriakides, our Commissioner for Health and Food Safety, and a close ally to all patients in Europe. She unfortunately could not be with us live today, but insisted on recording a video message for us. I wish us all a very fruitful discussion. Stella, you have the floor. Hopefully.
So let's watch that video. Thank you so much, Frederic, for that great and inspiring introduction, and congratulations on the study. Great news.
It is.
We should be going to that video in just a moment.
Ladies and gentlemen, every year on World AIDS Day, we remember those who lost their lives to the AIDS epidemic. We recognize the progress made until now, and we celebrate those inspirational leaders who fought so hard to get us to where we are today. But World AIDS Day in the middle of the COVID-19 pandemic has a very special resonance. We all have so much to learn from the global response to HIV/AIDS over the past 40 years. On the importance of global solidarity, of inclusivity, equality and innovation, on the urgent need to support the most vulnerable groups in our societies. So I'm delighted to join today's event, and I want to thank HIV Outcomes for gathering us today. Thanks to treatment advances, life expectancy has significantly increased for people living with HIV, and the HIV population is larger than ever. Too often, we focus on the disease, and not on the person behind the disease. That needs to change. And it's time to pay more attention to the long-term well-being of people living with HIV, especially as they get older. As a first step, we need to make HIV services easily accessible and to tailor health services to the needs of patients. We need new approaches to prevention, treatment and care. And we need to put fundamental human rights first so that we can end stigma and discrimination. COVID-19 highlights the fault lines in our societies and our health systems. It amplifies inequalities, targets vulnerable groups, and reveals a tendency to underfinance and underprioritize health. And I know that HIV patients have been impacted severely. We need to respond and address these inequalities, including those that exist for people living with HIV in regard to health-related quality of life. We are taking decisive, coordinated steps to create more inclusive, more equal and healthier societies. Firstly, we propose the European Health Union that will improve the resilience of our health systems. Secondly, our financial instruments, such as EU for Health, will support efforts to strengthen health systems and community response, as well as better clinical management. Team Europe remains the largest contributor to the Global Fund to fight AIDS, tuberculosis and malaria. And lastly, we are working with Member States in the steering group on prevention and promotion to identify and share best practices that can deliver concrete benefits to citizens. The near future other areas such as HIV/AIDS will also benefit from this approach. Ladies and gentlemen, dear friends, let me finish with an important point. We need to put the patient at the center of this discussion every step of the way, and we will continue pushing for patient-centered care as well as well-functioning health systems. I want to thank HIV Outcomes and other stakeholders who give voice to people living with HIV/AIDS. I urge you all to speak up loudly and systematically. I assure you that we are listening carefully to every single word. Thank you.
Commissioner Kyriakides there, talking to us about why this issue is so important, why it matters that we move now beyond viral suppression to that focus. As she said, time to pay more attention to long-term well-being of people living with HIV. And we heard from Frederick Ries, she said, people living with HIV should enjoy the same quality of life as everybody else. Both of them talked about this being a time to celebrate the progress made, but also as a time to reflect on the needs of the HIV population now and what can be done to address these issues. Frederick Ries said in her remarks, this should be an opportunity to open a new chapter in the fight against HIV, putting people living with it front and center. So we're going to talk today about that progress, celebrate those achievements, but also what needs to be done now. We're going to start, I'm going to have some conversations with three people, going to get some come and where we need to go, and then a panel to talk about how policy instruments can help us, EU policy instruments, how they can best be used to address the issues we'll be discussing. So lots of ground to cover. I'm going to be talking, get a reflection from an HIV clinician, from an academic, a researcher, and from an HIV activist and person living with HIV. Going to be questions each of about 10 minutes long. If you have any questions for them, you can of course put them in the chat, and if there's time I will take them as we go along. So let us start on our reflections at this moment, this 40th anniversary, and I'm delighted to welcome first Professor Jane Anderson, HIV Outcomes Co-Chair and Consultant Physician at Homerton University Hospital NHS Foundation Trust. Jane, it is great to have you with us. Thank you so much for joining us on World AIDS Day. For you, from a clinician perspective, let's focus. We know there's a lot of still to be done and we mustn't be complacent, but let's first focus and reflect a little bit on the achievements that we have seen. What for you have been the most important successes in terms of treatment and care over the last 40 years?
Well, thank you very much, Jackie, and thank you to the organisers for including me in this discussion, which I think is very important. Of course, World AIDS Day is an opportunity to remember the people we've loved and lost to this pandemic, and to actually take stock, I think, of the enormity of the human suffering and tragedy that it's caused. And so, having worked in the field since the 1980s, and answering your question about what's changed, well, treatment and effective treatment is really, there front and center. And we have moved from a time when everybody died to now, in my clinical practice, a time when, should somebody die, we investigate why and how we might have missed something or things we might have done differently. So what a shift in the course just of my own clinical career. And of course, the medication hasn't always been easy, and it hasn't always been as effective or as efficient as we'd have liked, but we're moving now. And I think we're moving quickly into a new era of medications. And I celebrate hugely the work that has got us to there, because of course, that in itself is a real, I think, example of partnership working, the numbers of people who've taken part in clinical trials to ensure that we've got medications that are effective. So that would be my first one. You've asked for two, and very quickly, my second one would be the diagnostic tools that have evolved so much. Because, of course, crucially, if you don't know you're living with HIV, then all those avenues for fabulous treatment are closed to you. And so knowing your HIV status is now the crucial gateway to both preventing acquiring HIV and to good treatment. So diagnostic tools and good meds, I think I have to put as my top two.
Thank you very much. So that's what we've achieved. As you say, quite remarkable what's been done within the time of your own career. But in terms of the challenges that are left, and today we're talking about shifting focus. Yes, of course, viral suppression, that UN AIDS target of eliminating it as a public health threat by 2030 remains, but very much feeling there is much more to be done. And we heard that from our opening speakers. What do you see as the key challenges ahead?
Well, first of all, I just want to put the fact that we do not have equity of access yet globally. So, and I know that's not the focus of today, but I have to say that we've got a long way to go to make sure that the things I've just spoken about are available to everybody in the way they need them. So we still have challenges, and they are continuing about how people need their care to be delivered in a personalized and particular way, assuming they've got access. And so, of course, I think we now need to shift our vision, and we need to take account of these advances. And actually, the focus has got to shift. It's got to shift towards a long life, well lived, rather than simply avoiding death and ill health. And that requires us to look at the whole thing differently, and to understand that what we did was fabulous and has got us to here, and we have to continue. But as well as that, there are now new needs, there are now new dynamics and a new narrative, and we have to engage with that.
So as you say, that situation that you've gone from everybody dying to asking yourself, what did we do wrong if someone dies, means many people living long lives. Now, this focus on health-related quality of life, why do you believe, what are those new needs? What are those issues that need to be addressed in order to really ensure, going back to what Frederique Ries said at the beginning, that people living with HIV can enjoy precisely the same quality of life as everyone else?
Well, social attitudes have been much slower to change than clinical attitudes. And so people are still experiencing stigma and discrimination, and society at large, and some work we've just done in the UK shows there's a real lack of understanding and knowledge. And that stigma and discrimination colours everything. It changes people's relationship to themselves, to their services, and it's absolutely fundamental that we need to address that. And stigma and discrimination within healthcare settings is absolutely critically important, because, Jackie, people now are using far more of the health system, because comorbidities, mental health problems, a whole variety of new things means that they're moving into other parts of the medical system that may not be so familiar, and equally is not joined up in a way that makes sense if you're living with a long-term condition with quite a lot of other things going on as well.
Can I just ask, when you talk about stigma within the healthcare setting, you're also talking about healthcare professionals who maybe don't understand what are you, is it the fact that people may not go for the treatments they need because of the stigma and discrimination, or is it among those who provide the care? Where is the issue here from a clinician's perspective?
Well, from a clinician's perspective, it comes from, I think, a variety of angles, and work we've done in the UK, Positive Voices, which has been asking people about their experiences. We know that a significant number of people living with HIV have actively avoided going to seek healthcare because they've been fearful of what might happen. Not what has happened, but the fear that something might happen. We then have a smaller proportion of people who've actually experienced stigma or discrimination, either in terms of the way their treatment's been delivered, or that they've not had access to the things they need. And this is not just in the UK, we've got some data here, but we know it's a global problem. Now, that stems from a whole variety of things, and part of it is lack of knowledge. The fact that U equals U, people living with HIV on effective therapy cannot pass it on. Things are still stuck, I think, in some of the knowledge. The knowledge hasn't moved forward, and we have got to change that. But again, it still reflects a siloing of care within health systems. So yes, the HIV services are working in one way, but other parts of the health system are not joined up necessarily in the way that makes sense and allows that knowledge to be transferred between parts of the system.
Just for a moment to focus on the impact of COVID, because we know COVID has been particularly difficult for vulnerable groups. There's clearly a vulnerable category. What has been the impact from your experience on the ground working as a physician? And in terms of undoing, there have been people expressing concerns that some of this success that we're celebrating right now could be undone because of the impact of the pandemic. How do we avoid that, Jane?
So what's been happening on the ground has, of course, been different in different places. But in general, an awful lot of services have had to change their model. People have not been able to access face-to-face care for infection control risks and a whole variety of other things. And actually, many of the clinicians who've been experts in HIV have been pulled into the COVID response. And so the staffing structures have changed and the way clinical services are organized has been changed. I have to say that I think overall, certainly in the UK, people have still been able to access the medicines they need, but the structures have been different. And we have to make sure that what was an emergency response to a catastrophe does not become embedded as the way we're going to continue. That was, we had to change, but now we've got to take stock and see what's the damage and limit what has changed and make sure that we pick up the things that are that might have come undone. And what I'm concerned about, we don't yet have a real picture, and this pandemic is evolving. This sense that, you know, we've been through this bit, we've got a long way to go with this. So we've now got to learn as we go along and make sure that we have got things in place that people with HIV can still access everything they need.
Thank you very much. And before I let you go, I have one more question, which is, and I know this is an impossible question to ask, but I'm going to ask it nevertheless, because policymakers, many of those in our audience today, always say, well, what do you want me to do? What's the key thing? If there was one thing I could do to help you in this, for you, if you had to identify, maybe not call it a priority for action, but a key next step, if we are to really effectively, right across the EU, and you mentioned equality of access and issues like that as well, if we are to really make progress in getting this shift of focus that you talked about, what for you is the key next step?
Well, if you don't measure it, it doesn't matter. So we've got to have indicators and measures, and they need to be embedded within national responses and continental responses, so that actually we are measuring what's happening. We can see what's changing. We can see what needs to be done. We don't have these universal metrics at the moment. And so I would like policymakers to deliver or to enable us to deliver on metrics, and to actually we can then hold politicians and systems to account, because we know what's going on. At the moment, it's a bit ad hoc.
Thank you very much. And it is quite striking that really a relatively small number of countries do include health-related quality of life in their HIV monitoring at the moment. So for you, a key area of focus, because as you said, if you don't measure it, it doesn't matter. Jane, thank you so much for being with us today. It's been really great to hear from you and get your perspective. Let us turn now to get an academic, a researcher's perspective on where we've come and where we're going. I'm delighted to welcome Professor Jeff Lazarus, HIV Outcomes Co-Chair and Head of Health Systems Research Group at IS Global Hospital Clinic at the University of Barcelona. Jeff, great to have you with us. Same question to you, but now from a researcher's perspective. What for you have been the sort of standout moments over the last 40 years?
Well, I think I'd be remiss if I didn't mention, like Jane said, I mean, simply the developments we've had in diagnostics and particularly treatment, and here, you know, correspondingly, the incredible amount of research we've had. And it's not just about the quantity of research, it's about so much high quality research now, 40 years into or officially into the pandemic, you know, research from every nook and cranny and corner of the world. And much of that research, which is what I'm really interested in, has been focused on public health aspects, on health systems aspects, on access to care. So we have the diagnostics, we have the treatment, we have the monitoring framework, what we were using before, the 390s, the 395s, and now there's research into how do we actually make sure that the populations are able to get diagnosed, to get onto that treatment. So for me, that's sort of the overall big picture message, 40 years into studying and characterizing the virus. For me, recently, the important research has been around going beyond the 390s, what we earlier termed the fourth 90, when we were focused on and started to put quality of life on the agenda for everyone living with HIV, but also, what we've now sort of called it, as you mentioned earlier with Jane, the focus on health-related quality of life. How do we understand that? How do we research that? How does that impact on people's ability to get diagnosed, get linked to care, get on treatment, and to stay on that treatment and have simply a good health-related quality of life and overall quality of life.
Absolutely. I want to come back on that in a moment in terms of those issues and how we can address them. But just for a moment, looking at COVID, and we talked there, and Jane was talking about, we have to make sure that the changes that were made, inevitably, there was no choice in a time of pandemic, but that they don't remain in place. But do you think in other ways, looking at this from a research perspective, from an academic perspective, COVID has highlighted the necessity to rethink approaches in some way, or do we go back when eventually this pandemic is over, simply pick up the reins of where we were before? Has it changed your thinking?
It absolutely has. As we saw health systems become overwhelmed, become saturated, and we realized that not only were we going to have a reduced number of diagnoses, but again, reduced linkage to care, problems with prescribing, getting people on treatment, even being able to pick up their treatment from pharmacies where although people were allowed out during the lockdowns and restrictions, it was challenging because of the persistent stigma discrimination. Those few moments you were allowed outside, if one of them was going to be used to go to a pharmacy to pick up your antiretroviral therapy and you hadn't disclosed, that was creating problems. So it became a very complex issue, and we need to understand how health systems can be re-engineered, moving away more from that acute care paradigm, the need to always see your HIV clinician and in a hospital and clinical setting, to thinking about long-term approaches, to thinking about how we can use digital health, digital technology. The digital health field has been moving very quickly the last year and a half, but it's also creating new challenges for us in the HIV field. How to avoid the digital divide? How do we ensure people have privacy? Do they have the right degree of digital literacy? Do they even have the right connection or smartphone or computer to be able to have that kind of interaction with their healthcare providers that some in the digital health field are working towards expanding, given what happened during the COVID-19 pandemic and what continues to happen as we still don't have the pandemic under control in most parts of the world.
Absolutely. Jeff, just coming back to what you said about when we focus on health-related quality of life, and you asked some questions, you said, how do we understand it? What research do we need to do? How do we measure impacts and so on? Where do you see the focus now in terms of trying to answer those questions, and what policy needs to do, if you like? I'm going to be talking more about policy instruments later on, but to ensure that you as researchers can begin to answer those questions and get that clearer picture that you say is needed.
Thank you. So it can depend a little bit on who you speak to, but I'm not one for a compromise in the research agenda. So let me try and sum up, what we've been hearing from both clinicians, from the community, and then Jane and Stefan and others will chime in. But I mean, on the one hand, in terms of health-related quality of life, we need to better understand the comorbidities that are most common for people living with HIV, but also the symptoms and signs that people living with HIV might be experiencing, and that might be impacting on their HRQoL, or might trigger clinicians to understand that a comorbidity is on the way. We need to be thinking about how we can listen to the community, what kinds of patient-reported outcome measures there are, so the community, individuals living with HIV themselves can report back. So it's these two large issues of comorbidities and related health issues that might be detected in a more hospital clinical setting, listening to the community and doing that regularly, through annual surveys of people living with HIV. So we have a baseline, can compare over time, compare their health-related quality of life to that of the general population. And then really just interventions to strengthen empathy. We talk a lot about stigma and discrimination, and Jane mentioned it as well. It's in the health system, it's rampant outside the health system, it's different with different populations and in different countries. And we really need to constantly be reinforcing that message that this is a virus, that on treatment, it's not transmissible, and people living with HIV need all our empathy from within the healthcare system where it's expected, but from family, friends, and from policymakers.
Just to follow up on that, do we know enough? Is there research needed into how you build that empathy? Do we need more work on overcoming some of those? Because it always strikes me when people say, even healthcare professionals don't necessarily, there is stigma within the profession, and I'm always very surprised. Do we know why that's such a challenge?
I mean, some of it goes to some of the populations that have been disproportionately affected by HIV. And in terms of the kind of research, again, there's two kinds of research, I think. There's speaking to the community about the stigma and discrimination they experience so that we can design interventions to mitigate and end that, but also tracking discriminatory laws and regulations that are on the books and that are still in different countries. So across Spain, where I'm working right now, we've been engaging with the different autonomous communities, and they've been reporting that there are still, in some settings, discriminatory rules and laws on the books, and that some of those communities are now declaring that they will become discrimination-free, that they will systematically look for what are those discriminatory laws and take them off the books. And we need to be doing that country by country. And there are great efforts, by some organizations doing that. But in 2021, 40 years, after the sort of official start of the epidemic, it just astounds me that we can still have this kind of discrimination at the highest levels.
Quite. A final question to you, Jeff, and it's the same as I asked Jane, and I accept it's an invidious question, but in terms of identifying ways forward, key next step, what we need to do most urgently for you, if on this occasion of World AIDS Day, this 40th anniversary, you had to identify a key next step to really get this focus that you've been talking about and really move us forward, what for you would be the most important thing to do?
Thanks. Well, at the AIDS 2021 conference, a large international or global group, including all sorts of stakeholders, clinicians, even policymakers, the community and researchers, issued a consensus statement. And although it has multiple recommendations, one that I think is important, that's very actionable for policymakers, is using indicators and metrics to measure health-related quality of life. So nobody, I won't say nobody, but people don't really want more indicators and metrics, but I think it's incredibly important that we systematically measure health-related quality of life, both looking at the comorbidities, but also listening to the community through validated and patient-reported outcome measures.
Thank you very much, and very striking that both you and Jane, that's where you put the emphasis. If we don't measure it, Jane said it doesn't matter, but if we don't measure it, we don't know what we need to do. So thank you so much, Jeff. Great to have you with us today. Now I want to turn to the people who matter most, and we very deliberately wanted to hear from the clinician, from the academic perspective, before I turn to those living with HIV, because I'd like to get our guests' reactions to what he's heard about how they see things and how he sees the challenge. I'm delighted to welcome Stefan Werners, who is HIV Outcomes Steering Group member and a coordinator of the AIDS Europe platform and Coalition Plus. Stefan, great to have you with us. Tell us, in terms of, as a person living with HIV, as someone, we've been talking about you, but I want to hear from you. When we look back over the last 40 years, what for you have been the key breakthroughs, the things that matter most, and not just in terms of treatment and care, but also in terms of getting your voices heard, getting your message out there? What have been the most important moments for you?
Morning, Jackie. Good morning, all. I'm delighted to be in this panel today, and I want to thank my fellow colleagues at HIV Outcomes for inviting me, representing in a very humble way people living with HIV. So if I may, Jackie, for me, there are two key dates. 1996. Basically, I found out I was HIV positive in 2000, and it was a real challenge, somehow a shock, although I was not that surprised. But more importantly, I knew I wouldn't die. Before 96, contracting the virus meant that it was very likely that sooner or later you would die. The breakthrough of antiretroviral changed things completely, from you're going to die to you are going to live. And then 2007, 2008, it started to become clear that if you have a stabilized and detectable virus load, then you could not pass on the virus. And excuse my French, Jackie, but what a bloody relief. Between 2000 and 2007, I was petrified to pass on the virus, petrified that after we had sex with a guy, he would ask me if I was HIV positive, and petrified that a condom would break. So the arrival of TASP, treatment as prevention, changed completely my sexuality.
Thank you very much. And in terms now, Stefan, of the challenge ahead and what we need to do, we've heard from both Jane and Jeff how they see it. From your perspective, we've done so much better, as you say. By the time you were diagnosed, you knew you wouldn't die. You knew that it was a question of how to live with it. What for you are the challenges ahead?
Well, basically, in France, in 2020, 50% of people living with HIV were 50 years old and over, and I'm 49. I'm going to get into this category next year. Therefore, we need to focus on how to age being HIV positive, but more importantly, how to age well. And also, there is so much stigma and discrimination, and especially for key population, such as men and women of color, migrants, sex workers, trans people. I'm a French gay man living in Paris and living with HIV for 21 years. I consider myself as lucky. However, just to give you an example, a couple of weeks ago, I was chatting with a guy on a very famous yellow and black dating app. All the gay men listening to us today will know what I'm talking about. As we were about to meet up, he asked me if I was clean. I explained that I was positive with an undetectable virus load, and I could not pass on the virus. I sent my answer. 10 seconds later, the guy blocked me and disappeared from the app. It is indeed very, very terribly violent, but today I can handle that. I came out as being HIV positive publicly to my family and friends in September in a video I did for my NGO. I am fine, but I'm thinking of all the guys out there not dealing very well with the fact they are HIV positive. Such violent rejection will lead to shame and even lower self-esteem. We need to keep fighting stigma and discrimination. Make no mistakes, serophobia is still alive and kicking.
Absolutely. So when we talk about long-term well-being, Stefan, we are talking about the physical, you talked about aging well, we are talking about the mental, you talked about the stigma that is attached, and we're talking about the social attitudes, and it was mentioned earlier, the different social attitudes within the healthcare system. How important do you think it is, this discussion that we're having today, on shifting the focus, moving well beyond just talking about viral suppression, important as that is, to this focus on long-term well-being and on health-related quality of life? How much difference do you think it could make?
Well, it is necessary for people living with HIV not just to live long, but also to live well, and to prevent the impact of COVID-19 pandemic from further challenging health-related quality of life. But also, it remains very important for me to explain and to be bold and loud about you equals you. It has to come from us, people living with HIV, but also I want to reach out to the whole community who might be listening to us today. We must be confident and very clear that a person living with HIV with long-term undetectable virus load cannot pass on the virus. Studies such as Partner 1 and Partner 2 back that up. U=U is a fact.
So education, awareness, very much part of the answer to this puzzle of how we get this focus and of how we address those issues. Just to ask, I want to just come back to the COVID point for a moment, Stefan, and for you and for everybody, you're an activist, you're talking to a lot of people in the community about their experiences. What has the impact been? And are you worried now, as Jane was expressing a concern that if we don't make sure that the things that changed, we undo where we need to, and we make sure, are you worried that what has happened during COVID could set back progress and could shift the focus in the wrong direction?
A couple of things before I answer your question.
Sure.
Civil society organizations and community activists have played a long-standing role in the HIV response, where we have always been at the forefront of ensuring effective and equitable services. At the beginning of the HIV epidemics, civil society organizations were the first responder with community-led initiatives to fight stigma and discrimination, undertake advocacy for human rights for people living with and affected by HIV, and raise the profile of HIV in the public health agenda. Now, coming to COVID-19 pandemic, facing the COVID-19 pandemic, civil society organizations have partnered with national AIDS control programs and adapted the services to ensure the continuity of health services for people living with and affected by HIV. It is unbearable for us, people living with HIV, that a pandemic can hide another one. We were on the way to end the HIV pandemic by 2030. The COVID crisis has made us going backwards.
So as we look to hopefully before too long a post-pandemic period, what is your key priority now if we are to shift that focus, get that mindset change, address the issues? What for you is the key next step, the most important thing we need to do, Stefan?
Well, Jackie, I'm French, so obviously I'm not going to follow the rule, and I'm going to give you 3 priorities.
You can do it if you do it in a minute, 2 minutes.
In a minute, I will be quick. First of all, there is a widespread recognition that important aspects of the health and well-being people living with HIV receive insufficient attention from policymakers and healthcare providers. This has to change. B, we won't stop the HIV pandemic without PrEP. The immense majority of people using PrEP are MSM, men having sex with other men. We need to make PrEP available for everybody, and especially for key populations such as men and women of color, migrants, sex workers, and trans people. 3, I want to say very loud and clear, engage civil society and people living with HIV more in decision-making on HIV. Basically, Jackie, nothing about us without us has never been so meaningful. And the commissioner said that earlier on. So as a conclusion, my thoughts go to the 30 million people who died of AIDS over the past 40 years, and to all my brothers and sisters who keep fighting today.
Stefan, thank you so much. And thank you for the passion with which you pursue this fight and your eloquence in describing both the challenges, but also what needs to be done. It's been truly inspirational to hear from you today. Thank you very much. And thank you, Jane and Jeff, again, also for those insights. So some reflections there, and undoubted those remarkable milestones, key moments of progress, but also that huge challenge ahead to address some of the issues identified by all 3 of them. What we want to focus on for the next nearly an hour is what are we going to do in terms of policy vehicles, policy instruments that can successfully tackle this issue of improving health-related quality of life for people living with HIV. What tools are available? The EU at the moment, a raft of initiatives in the health arena. What tools are available? How can we best use them? And crucially, how do we meet that implementation challenge at the national level? So the EU can help with the instruments and tools, but to implement them requires national action. Let me bring in our panel, and I'm delighted. And don't forget, ladies and gentlemen, if you have any questions for our panel, please do put them in the chat and please be brief. Let me introduce our panel. Delighted to welcome Cyrus Engara, MEP, a member of the European Parliament's Environment, Public Health and Food Safety Committee and the Special Committee on Beating Cancer, which has a focus, I think for the first time, a focus on that quality of life issue. We have with us Vinay Saldana, Special Advisor to the Executive Director at UNAIDS. Great to have you with us, Vinay. Thank you so much for joining us. We have Mario Cascio, HIV Outcomes Steering Group member and chair of the Quality of Life Programme at the European AIDS Treatment Group, a patient-led NGO, EATG, and Jens Arends, Head of Prevention and Health Promotion Advisor at Berliner AIDS Hilfe, NGO activists and service providers working in the community on these issues. I want to start really by just getting your perspectives, and Cyrus, maybe I could start with you in terms of this shift of focus that we're talking about. Why does it matter? Why is it important? And are we on the right track to deliver it, do you think? Cyrus.
Thank you, Jackie, and thank you for inviting me for this discussion today. It's such a pleasure to be here with you all. I think that it is very important to discuss the quality of life of those people who would be HIV positive, irrespective of the viral load that they might have within their journey with HIV. I remember a time when I was young, 20 years ago, where people used to tell me, you know, I come from a very small country, Malta, from a much smaller town within this country, where my friends, my loved ones, were very much concerned because I came out as a gay person, and everyone thought that this was more or less a death sentence. They used to speak to me as if, you know, being gay and therefore being sexually active or having a partner, etc., would mean my death sentence at some point. And today, I'm very happy that this has changed, and this has changed thanks to science. It has changed thanks to our society. That has also moved forward from that. However, when you look at science, we have reached a lot. Today we have a situation where, obviously, as we have been hearing and as all of us know, an HIV positive person can lead a normal life and have the same life expectancy as everyone else and not even transmit that virus to others. That being said, we still have a problem, I believe, in policy. A problem in policy, both at European Union level, but also within our different member states. First of all, the situation is different in all member states. So an HIV positive person in France, for instance, as we have been listening, has certain medication that they can use, has certain life guarantees, but then someone else who, for instance, is born in or lives in Hungary, for instance, in Poland, or even in my country, Malta, which is a champion for LGBTIQ rights. But then when we see what we do as a country for HIV people, then I see a very big imbalance. And I think that this is where we need to focus on. First of all, we have an issue with.
Cyrus, let's come back on some of the detail of that. That is the broad picture. Thank you. I will come back to you on that. I just want to build a picture. And Vinay, I'd really like to come to you now, because UNAIDS, of course, has a new strategy, End AIDS, End Inequality, End AIDS, I think is the strapline of it. How do you believe, why is this issue so important, and how does it play in, how is it featuring in your strategy? What is the challenge here?
Thanks, Jackie, and good morning, good afternoon to all the participants on this extremely important call on World AIDS Day. Let me begin by actually a small clarification, Jackie. Yes, UNAIDS developed a new strategy, but it is not a UNAIDS strategy. It is a global AIDS strategy. So this strategy belongs to all the member states of the UN, all the communities affected by HIV, and we all share a common responsibility for translating the global AIDS strategy into European plans, international plans, to really make sure that the very different, much more granular and ambitious targets and commitments that are reflected in the strategy actually get achieved by the end of 2025. The clock is already ticking. And in that respect, just to highlight the fact that we have 22 member states on the UNAIDS program coordinating board, not all EU members are represented in our board. And so the UN General Assembly took forward in June a special session on HIV and AIDS to translate the targets and commitments in the global AIDS strategy into a global policy document that was adopted at the UN General Assembly in June. And I was one of the technical leads supporting the negotiations. I would like to really commend the very strong engagement from the European Union and EU member states in the negotiation process on the political declaration that was adopted at the UN General Assembly in June. And so there is a whole new set of extremely ambitious, very fresh and very different targets that need to be achieved by the end of 2025. Let me just share a couple that are very specific to the quality of life of people living with HIV. One is that the 90-90-90 targets were up to the end of 2020. We now have 95, 95, 95 targets. And what's beyond just raising the bar for everyone, these targets are now much more granular because they actually require all countries, including every EU member state, to be able to show, hopefully on an annual basis, that progress towards the 95, 95, 95 targets are not only being made at an abstract national level, but that they're disaggregated according to all key populations. And so I was very touched by the words made by Stefan earlier that, you know, there is still rampant stigma and discrimination vis-a-vis LGBTIQ communities, vis-a-vis within and directed towards different key populations. So all countries need to get serious about reaching these targets and showing that the targets are being achieved for LGBTIQ communities, migrants, drug users, and that we are really ending inequalities and the differences between different demographics as we make progress towards these targets in 2025.
Thank you very much. And that goes back very much to something that both Jeff and Jane in our reflection session talked about when I asked them for their priorities. It was always all about monitoring, about measuring, because what you, as Jane said, if you don't measure it, it doesn't matter. So very interesting to see that. And as you say, how do we translate that? I want to come back, Vinay, to you and everyone in a little while on those EU policy instruments and how they can really be used to deliver. But let me get a perspective from Mario Cascio now. Mario, from your perspective, just to I think it's worth reinforcing why you believe this shift to focusing on health-related quality of life is important, and whether you believe we're on track to do that. Do you think the instruments, the policies we have are doing that already, or do we need a really radical rethink here?
Thank you, Jackie, for the question, and thank you all for being here today. It's a pleasure to be here with you. Well, first of all, I must say that health policies at European level have paid no systematic attention to the health-related quality of life for people living with HIV. But as we all know, you know, the HIV landscape has radically changed in these 40 years, and so have the care needs of people. Survival, I mean, we all know that survival is no longer the ultimate outcome. People are living longer lives, but many new health challenges are emerging. And I think our focus 40 years on should be that of ensuring good quality of life to all people living with HIV. And the new global strategy actually moves in this direction. It takes into account this evolving landscape and should be our guiding star. And I believe now is the time for EU institutions to rapidly adapt its health policies to these emerging needs of people living with chronic long life conditions such as HIV, focusing more on the well-being rather than on disease. And I also think that our policymakers should be made aware of how an holistic, person-centered approach to HIV care can improve both our response to people's needs and at the same time ensure the sustainability of our healthcare systems. And finally, I would say that we should try our best to draw on the many lessons learned from the COVID pandemic to inform our future health policies.
Thank you. And we heard about that also in our reflection session. Maybe come back on what those lessons are from COVID and how we can apply them most effectively. But Jens, complete the picture for us, both important in terms of the importance of this issue, but also that key translation of EU level policies. And we're going to delve into them in a bit more detail in a moment, not just at the national level, but you're in Berlin, you're in a city to the regional level, local level, within communities, because it was that point that was made about by Vinay about, you know, for very different communities, what is the impact? What do we know? How do you see the current situation and the challenge ahead? You're muted at the moment, Jens. Sorry.
Thank you. Thank you, Jackie, for this question, and thank you for the invitation and for the possibility to be here today at this important day, the World AIDS Day. I would like to come back to something what Jane said before, and it's about inequality in the countries, in the EU countries. So I live in Berlin, as you said, and we have a good situation here. We have reached our goals so far. We are with 92, 98, and 96, and we have access to care here in Berlin for most of the people. But if I look to the countries which are more in the east, the situation is much different, and I would come back to this. So I would come to the situation of the people who are belonging to the key population who live in Belarus, for example, in Poland or in Hungary, and there's a great gap in comparison to the Western European countries, as Germany or France or Great Britain as before, or Italy or so. So it's clear that the policy of the European Union must change with respect to these countries who repress people of the key populations. These are men having sex with men, so people belonging to the LGBTIQ population, but also trans sex workers or people who belong to the trans communities or people who use intravenous drugs. If we suppress those groups, they will not have access to care, they will not get tested, and therefore the goals 94, 95, 95, and 95 will not be reached there. And we are very much alarmed in Berlin about the situation of the people, for example, in the neighbor country, Poland, and as put before, Belarus, and also in Hungary. But if I look into my own country, there are also gaps which has to be focused on. So we have a good situation, good access to care when we are having a health insurance. So I have been living with HIV since 1996, and I'm quite well. I'm growing older now, I'm 45, and I don't have so many problems. I just live with HIV, and I can work and do my job every day. The situation is different for people who are not insured, who don't have a health insurance here in Germany. Yeah. And these are people we call persons sans papier, for example, the people who are illegalized or refugees, or people who don't have health insurance for other reasons. They don't have easy access to care, and we are working in Berlin to maintain the situation in order to get the situation better in terms of that we have a checkpoint, for example, where people can go to, and then the checkpoint will check the situation of the people and try to get the access to medication.
Absolutely. So that point that Vinay was making about being much more granular and knowing and measuring and reporting on what's happening to different communities is very important. Cyrus, let me come back. You talked about a problem of policy at EU level and national level, and we've heard about some of those issues already. For you, the key challenges now, if we are to, as Vinay was saying, and I want to come back, Vinay, to how you see this working in a moment, but Cyrus, for you, do you think we are broadly on the right track and it's a question of implementation of EU policies, or do we need a change of thinking in terms of this raft of initiatives? We've had the EU for Health programme, the Health Union itself, the pharma strategy, the extension of the ECDC's mandate, lots of initiatives. Is it a question of implementation, or do we have the wrong tools and instruments?
I think we do not have the right instruments in place yet. We're moving towards that. We're moving towards a European Health Union, as you have mentioned. We have a new pharmaceutical strategy, which we have voted upon last week in our plenary. However, we still face a number of issues. First of all, health policy is not as yet a European Union competence. Most of the competence lies within the member state. So when it comes to places like Poland and Hungary, which we have mentioned already, where you have very conservative governments who are totally eliminating literally LGBTIQ people from the discourse in their countries, then that is a problem already. So therefore, we need a more holistic and a more harmonized approach to health. And I would also lead that to also when it comes to medicines and pharmaceutical medicines, drugs, etc., where we need to have a system which leads towards more joint procurement. We had for the first time joint procurement for the COVID vaccination, which worked. It had a bumpy start, but at the end of the day, worked out really well. And this meant that every member state had access to affordable vaccines. And we need to have the same in other areas, including in antiretroviral therapy and other medicines, which are very important for different patients. We need this because we have a reality where a number of countries do not have access, or they don't have access to the right kind of therapies, unfortunately, because either of outdated systems like we had in my country, Malta, but then when we finally moved on and had the best, let's say, therapies that one needed, then Brexit came, and since we buy everything from the United Kingdom, then we got blocked again, and we had months where our HIV positive citizens did not have access to their antiretroviral medicines that they used to take. So this is a reality in a number of member states, and this needs to be tackled at a European level in order to make sure that there are less inequalities between the different member states, and that we assure that every single citizen has the access to this medication if they need it, in order to make sure, first of all, that they can live a good quality of life, but secondly also not to transmit the virus to others.
Absolutely. Vinay, coming back to you, and I wanted to sort of link this to the WHO definition of health. And I quote, a state of complete physical, mental and social well-being, not merely the absence of disease or infirmity. So when we're talking about the issues we are focusing on today, this health-related quality of life issue, what for you is the key to translate? You said earlier, we have a global strategy. You rightly corrected me when I referred to it as a UN/AIDS strategy. To translate it to European plans, national plans, what is the key to making it more granular in this area? And how important might this shift of focus be, do you think?
Thanks, Jackie. Fully agree. I mean, a very practical example. I'll come back to an important point made by Jens earlier, that we're seeing very different HIV epidemics in different parts of the WHO European region, and even within the EU, we have whole communities, whole populations, including migrants, that are falling through the cracks of the system. There was an excellent report launched earlier this week by ECDC and WHO Euro that shows that there is a disproportionately high number of new HIV infections amongst migrants. But those migrants are not arriving in Europe with HIV, they're acquiring HIV after they arrive in Europe, which shows that the public health systems, the health systems, are still not addressing the needs of communities in a granular, human rights sensitive, inclusive and targeted way. There is so much that needs to be done in this area to focus on ending inequalities, making sure that everyone within the European Union has not only access to, but is actually using this life-saving services that are available. Another practical example, and hats off to Jane Anderson and the NHS in the UK for championing and actually rolling out the use of injectable antiretroviral drugs over the long term. But this is still a dream for many countries within the European Union, let alone countries within Central Europe, let alone Eastern Europe, or the CIS countries, which almost do not have access to injectable PrEP. So at a time when public health and ending pandemics is important not only on World AIDS Day, but really has to be our leitmotif moving forward. We really need to get serious about questioning whether patent protection needs to take precedence over ensuring that everyone has access to life-giving medicines and health technologies that are absolutely essential to end AIDS, end COVID-19, and be better prepared for the next pandemic.
Thank you. Mario, you said earlier, health policies have put no systematic attention to the quality of life issues, and this needed to be the guiding star. In terms of seizing this moment, this is a moment in the EU where the pandemic has put a real focus on health policies, and I mentioned, and others have mentioned, some of those initiatives that are being taken. What is the key for you to using those instruments to genuinely make it the guiding star? How do we get that shift, do you think? Well,
first of all, I think that one of the things that we can take as a conclusion from the COVID pandemic, for example, is what came out is that there is an undeniable need for solidarity in the field of health. Solidarity, which is something that we have experienced very strongly in the first, let's say, months of the epidemic. I remember here in Italy how things, there was a very strong sense of solidarity among people. And this was reflected also, let's say, in healthcare. I mean, there were so many restrictions, so many different difficulties in accessing healthcare. And I've seen, for example, something which happened during the starting of the epidemic, which is something was very unusual. There was a very, very strong collaboration between healthcare professionals and HIV clinics, for example, and community workers. And this has allowed, for example, the continuity of care in many cases. This has allowed the support of people, even in places which were very difficult to reach, in rural areas and so on. So I think this is one of the learnings that we can take from the pandemic, is that we have to protect the most vulnerable and actually address also the socioeconomic determinants of health. And this can be done, I mean, in the future. First of all, if we don't go back to where we were, for example, at the start, you were saying that in the first part of the meeting here, that there was a concern that we may be going back to a new normal, which is dictated by what happened during the COVID pandemic. And in my experience, I've seen this a lot because, many patients are getting used to less, contacts with their clinics, less contacts with their doctors. I mean, this is one of the challenges that we will be facing now in the near future, in getting these people back fully into healthcare, for example. And to address the social economic determinants, because poverty and social inequalities have been a strong determinant of poor health outcomes, of poor access to healthcare systems during the COVID pandemic, and we saw it has been highlighted by the pandemic. And let's say to include this in future HIV care, we will need to put in place some well-structured referral pathways, which would allow to refer to other services which are available on the territory. So it will be like a big cultural change only. It's not only a change in the organizational part of healthcare systems, but also it's a cultural change in understanding health on a whole.
Absolutely, and cultural change is the hardest to achieve. So I'm going to come back to everybody on what is the key to unlocking that cultural change. But Jens, from your perspective, do you see this with the raft of EU health initiatives as a moment of opportunity? That we have some instruments not to address. They're not strictly only health-related issues, of course, the issues you're raising about the situation in the East. But do you see these instruments as important vehicles in order to address this issue of quality of life more effectively, or is something missing?
Well, I think we must make sure that if we have a perspective from the EU policy, that we have to involve the bottom-up structure of the NGOs in order to implement good strategies. So I think Stefan has said that before, nothing about us without us, which is so important statement has been for many years. That it's called the JIPA principle, the greater involvement of people living with HIV and AIDS. And if we want to have successful strategies, we must implement the peer principle, the NGO structures from the bottom to the top, and that is something which is very important if strategies should be successful.
Thank you. Vinay, just coming back on that, because you talked about translating this into European and international plans, but also that role of NGOs, that role of civil society in this area, so crucial. How do we translate it even down to there? And would you agree with what Jens is saying about that importance of a bottom-up approach? Vinay first, and then Cyrus, the same question to you.
Thanks, Jackie. I could not agree more strongly with Jens. Thank you, Jens, for citing the JIPA principle. In fact, 20 years after the first UN General Assembly special session on AIDS in 2001, the JIPA principle was actually explicitly mentioned in the UN General Assembly high-level political declaration adopted by member states in June of this year. So it took 20 years to actually get JIPA referenced explicitly in the political declaration, including explicit references to key populations in the operative paragraphs of the declaration. Now we need to move to implement the declaration. The declaration has these things in it because of very bold and very active participation of the EU member states in the negotiation process. But for example, some of the challenges that we're facing around stigma and discrimination, including in healthcare settings, is every bit as much a global challenge to ending AIDS as it is to a challenge to end AIDS within the EU and its member states. So the political declaration, the global AIDS strategy, has a very clear, ambitious target that by the end of 2025, less than 10% of people living with HIV in key populations should experience stigma and discrimination. That's going to require all of the apparatus of the EU, the Commission, its member states, the EU Parliament to move more boldly on actually removing and adjusting punitive laws and policies to make sure that people living with HIV in key populations are fully respected and celebrated and have a role at the table, not just free from stigma and discrimination, but in the policy-making process. It's so important, it needs to be done. And this is another area where the EU and its member states can really be a shining light to the international community on how to really get serious about ending AIDS.
Thank you. And Cyrus, that raises the issue. I mean, I was focusing when I talked about the raft of EU initiatives on initiatives in the health arena, but we are talking much more broadly when we talk about a holistic approach. It is some of those laws, those policies, has been highlighted by our other panelists. Vinay, they're appealing for a bold approach to doing this. What do you see as the role of the EU in terms of making that happen, getting that bold approach? And just also, if you could pick up on Jens's comment and Vinay following up on that, on this bottom-up approach. It has to involve how you see the relationship between what you do as a policymaker and what people like Jens and Mario on the ground are doing.
Yes, I consider myself as an activist.
You're bottom up and top.
Exactly. For a long time, I was involved in LGBTIQ rights NGOs within my country. And I think one idea which really worked well in Malta, and that is how we changed all the laws that needed to be changed when it came to the LGBTIQ community on equality, was that we, government promised an LGBTIQ consultative council made up of the different NGOs. Basically, government entrusted these NGOs not only to propose policy, but to draft the actual laws themselves, to draft the actual policies ourselves. I was made the first chairperson of this consultative council, and we managed literally to put Malta from, the worst country, one of the worst countries when it came to LGBTIQ rights, to a hero today when it comes to rights. We're the first on the LGBTIQ rainbow map by ILGA Europe. And I think this is what needs to be done. Whenever we speak of LGBTIQ rights, or else the rights and the life of HIV positive people, we cannot have policy without including those people who are actually affected by that policy. If it is other people who write those policies and laws, that means it would not reflect the basic needs of those people who actually need those laws in place. And that is what we did back home, and that is what I try to bring here with me in Brussels, in the European Parliament, because I think that that is the way forward in order to have bold and ambitious commitments and policies in order to help people live a better life. And with this, I hope that in the coming months and years, as we did with cancer, we'll have the same kind of approach to HIV and AIDS within the European institutions in order to beat this virus, because I believe that we can beat it, and in order to beat it, we need to be very ambitious and very bold.
And you mentioned, Cyrus, the same approaches to cancer. I just wanted to follow up on the cancer plan, the Europe's Beating Cancer Plan, which does have this focus on quality of life, innovative in this sense. What can we learn from that? And could we build on that to create, if you like, some sort of disease neutral framework where you would treat all, whether it be HIV, whether it be whatever it be, to make sure that this quality of life element, I'm wondering if that's one of the keys to the culture change that we need.
Yes, it could be. In reality, we started the Beating Cancer Committee because science tells us that 40% of cancers in the European Union are preventable. In the same way, when we speak of HIV and AIDS, we know that HIV and AIDS can become something of the past. So we need to have the same effort in order to make sure that we have the right policies in place. And it is not simply policies on quality of life. It is not simply policies on access to access and affordability of therapies. It is also a question of education as well, because I'm sorry to keep on going to where I come from, but that is the example I know best. This year, once again, notwithstanding the fact that we have the best LGBTIQ rights in Europe and many other a very good health system, etc., in Malta, we have the highest number of new HIV cases per capita in Europe, and that is a big problem. So, and in our case, what I can identify as being the problem is a lack of sexual education, for instance, a lack of education when it comes to other matters, for instance, drug-related, etc. So we need to have a holistic approach to this challenge, but I know that we can win this challenge. And in order to win this challenge, we need to unite together, activists, NGOs, policymakers, in order to change the way that we think, the way that we look at things at the European level. And with that change, I believe that we can win. And let's work together to win.
Thank you very much, Cyrus. In terms of that, it's great to have that optimistic outlook. We can do it. Jens, what for you is the key to getting that cultural change? What is it? I was very struck earlier. Jeff Lazarus said in our reflection session, he was talking about strengthening empathy. Was the word he used. And we've talked a lot about stigma and discrimination. Is it primarily for you an issue of education? Is it primarily an issue for you of legislation? What is the key to drive this? Same question to you all. What do you think is the most powerful tool to drive this change of approach and build this empathy Jeff was talking about?
Well, stigmatization is the key to everything, and if we must fight stigmatization, and we must find tools to do so very successfully. But again, there is a gap in the countries. From a perspective from the EU, we must set up programs to fight stigmatization in each country, and this is the greatest challenge we have in the moment. But we have tools, because we have the Fast Track City initiative, for example, and a part of this Fast Track City initiative is the no stigmatization at all anymore. We are far away from that, and I would exchange the road. I would not say 90, 90, 90, 0 or 95, 95, 95, 0. But I would put the 0 at first. So I would say 0, 95, 95, 95, because without fighting the stigma, we cannot reach the other goals. So I would put back the question to the EU policy: how can we be supported by you to fight stigma, and how can the Fast Track City initiative can be supported to maintain these goals?
Before I move on, can I just put that back to you? What do you want from them?
We want, I personally,
Yeah.
I said at the beginning, first of all, we have to get away with inequality.
Yeah.
So everyone in the European Union who is vulnerable to HIV or to hepatitis C or to tuberculosis must have the same possibility to get access to care and not to be discriminated
Sorry,
for.
I meant specifically on the issue of stigma. What do you think policymakers can do to help address that issue specifically?
Well, on one hand, we can do it by campaigning things. So the government of a town, of a city, of a region must do a campaign against stigmatization. There have been many examples of good practice how we can do that, but we have to involve the NGOs because they know the best how to fight stigma and how to empower the key populations. So the dialogue is the important thing. The policy must go into the dialogue with the experts, how to do it best.
Absolutely. And of course, there is also EU funding available, making best use of that, providing best practice sharing platforms and so on. Mario, for you, in terms of this culture shift that we need, this change of approach, what do you think the key here is to, and if you agree with that way that Jeff framed it, to strengthen that empathy and tackle stigma and discrimination? Same question to you all, and then I want to come back to the point of working together. But Mario.
Well, first of all, I want to highlight the fact that, going back to our broader discussion on health-related quality of life, I mean, stigma and discrimination are still out there after 40 years. We've made great progress in all the fields, except in stigma and discrimination. And it's still impacting, I mean, the mental health and the social lives of people. And these, in turn, are often leading to depression and situations of social isolation. So it's a big problem. It's a big problem which actually affects the quality of life of people. And it has always, I mean, I've always been saying this. I mean, I'm living with HIV for almost 40 years now, so I've gone through most of the epidemic. And ever since the start of the epidemic, it's always been very underestimated at this point and very under-investigated. So going back to what you were asking, I mean, tackling stigma and discrimination within healthcare settings, something can be done at the policy level. I mean, we should be informing, we should be training our healthcare professionals, especially the younger ones, on HIV, on the story of HIV, on what stigma and discrimination among people living with HIV are, how the different layers of stigma and discrimination come together in different groups of people living with HIV. So I think a lot can be done there through education and regular training. Regarding the broader discussion on stigma and discrimination in our society, it's a more difficult thing to tackle. I think one of we've always been trying our best in different ways to find ways of communicating better, making people understand these problems in our community. But I think we do have this very strong tool, as Stefan was saying at the beginning, the U equals U message, which should be very strongly, included in as many policy documents as possible. This would make it really try to effectively message through the general population on what this means.
Thank you. Vinay, you wanted to come in on this point.
Yeah, if I could, and again, thanks to Mario and Jens for highlighting continued challenges of stigma and discrimination. I'd just like to reconfirm that UNAIDS has launched a global partnership against all forms of stigma and discrimination. And we are actively courting member states. We would be honored and celebrate if the entire EU and all of its member states were to join the global partnership. So it doesn't get a sense that, oh, this is something that is developed in the North or in the West for low and middle income countries. We have challenges on stigma and discrimination in every country, in every community. And so it's a very practical initiative that the EU and its member states can join, and it has a series of policy commitments that then would enable UNAIDS and all of our UN partners to work with the EU and its member states on moving forward on the elimination of all forms of stigma and discrimination related to HIV. And this is something that we wouldn't do only with the EU institutions, but this is extremely important role that we can work forward on with EATG, with HIV outcomes, with the community-based organizations all across Europe that really need to continue to be at the forefront in calling not only on World AIDS Day for an end to stigma and discrimination.
Thank you, Vinay, because just to follow up on that, I mean, Cyrus was saying a little while ago, we can win this challenge. We need to unite to change the way we think. You there very much emphasizing this is a partnership. What do you believe, Vinay, is going to be the key to making that partnership really work? What are the key ingredients? Because you've all talked about the importance, and you said European plans, national plans. We heard a very powerful plea from Jens for that bottom-up involvement of NGOs. How do we create partnerships that really address this issue in the holistic way that you've all been underlining is so important? What's the key to success here?
Thanks, Jackie. If I could just start, but I'd really be interested to hear the same question posed to our other panelists as well. I mean, I've highlighted the global partnership against all forms of stigma and discrimination. Join the partnership, contribute to it, help it get implemented in every country across the EU and in every community. And also it was highlighted earlier, I think, by the honorable representatives that we had, both MEP Frederick Reis and Commissioner Kyriakidis, who talked about the incredibly important role that the EU and its member states have as the leading funder to the Global Fund. Equally important to get continued funding for UNAIDS, to get continued funding for bilateral programs for HIV. Especially in the time of COVID-19, we don't want to be pitting one disease-specific approach against another pandemic. We need to take a holistic approach and remember that we cannot allow the COVID-19 pandemic to blow us off track from ending AIDS by 2030.
Which is why also I raised that question of we have in the Beating Cancer Plan this emphasis on health-related quality of life. How can we mainstream that? How can we make sure, as you say, it's not disease specific and there's no competition? Money, you said, there's EU funding, more EU funding available than there has been because of the focus. Cyrus, for you, the key to effectively uniting, you issued that plea, we need to unite to work on this. What's the key and what role can the EU particularly play in providing platforms? UNAIDS, as we've heard from Vinay, is doing it. What can the EU do to foster that collaboration? Same question to all of you before we begin to try and draw some conclusions from the discussion.
And I think it starts with us who are here today, and where we know each and every one of us is working on this, maybe separately, and we can join together. As for the EU, I mean, as my office is open, and I'll be contacted Vinay as well after this meeting, in order to make sure to push and lobby not only member states but also the European Union to join the HRQoL, and that is something very important that we can do from here today. But apart from that, let's work together. I mean, the LGBTIQ intergroup in the European Parliament is very active, not only on HIV and AIDS, but on more horizontal way. Let's take this on board. Let's make sure that the European Parliament is the institution that pushes the other institutions, because at the end of the day, that is the way it works. We have had the commissioner with us. The commissioner is someone who is pushing for a lot of more commitment from the EU on various diseases, and I think that is something good. But we need to be the ones who are pushing even for HIV and AIDS to take more prominence. It does not mean, as we said, that we reduce the importance of other diseases, because everything is important and everything needs to be tackled, but we need to put ourselves in the discourse. If we don't do it, no one will do it. So I think this is a good opportunity to do this from today onwards.
Absolutely. And Mario, you've been appealing constantly for this holistic approach. And what we're talking about, focusing on health-related quality of life, so important in this area, but so important for so many diseases. So what can be done, and whether HIV can be a sort of a leader in this area in terms of shifting that focus and making sure we have it. How do you see building the sorts of partnerships that are needed to really make that work? And do you see through the UN AIDS initiative, through EU initiatives, are we doing the right things to get that collaboration really working effectively? And then to Jens.
Well, first of all, I think,
sorry, hang on, Jens, just to Mario first, and then I'll come to you.
Well, I think it's me or Jens?
Yeah, Mario okay. First, and then Jens.
So I think the EU can certainly play an important role in providing guidance and recommendations on how health-related quality of life can shape our health policies in responding better to the needs of people affected by chronic lung conditions such as HIV. And it can be also very vigilant on human rights violation and criminalization of specific groups, as we have been discussing earlier by some of the panelists. Okay, situations in Poland, for example, and other parts of Europe are very important to monitor. And as a key ingredient, I would see a strong collaboration and synergy between the HIV community, clinicians, researchers, and policymakers in shaping national and local strategies on HIV, highlighting and providing evidence of the emerging healthcare needs of people living with HIV, and keeping national strategies in line with the international guidelines and objectives. And of course, communities can indeed play an important role in highlighting the needs of specific, underserved, and highly stigmatized populations, their barriers in accessing healthcare, and their difficulties in staying connected to services. They are a source of valuable information when updating guidelines and recommendations, but also in the design of services, which often are not available and are often not very friendly. So this, I think, would be a key way of seeing it.
Thank you very much indeed. Yeah, sorry, I stopped you earlier. Please, you have the
Everything
floor.
is fine, okay. Sorry for breaking in too. I like the idea of the exchanging of best practice models very much. And I think Fast Track City Initiative is a very perfect way to do so. So we have learned so much over the years how to do prevention and how to empower the target groups. And I think the Fast Track City Initiative is a good way to exchange these models of best practice. We in Berlin, we have learned about new groups and how to access new groups. For example, our checkpoint has had a little research on homeless people, and homeless people were not seen in this HIV context before. And we learned from this point study, from the checkpoint, that there is, of course, the need to deal with this target group as well. In Berlin AIDS Circle, we had a peer-oriented approach for Russian-speaking people, and this peer orientation was the key to open this group to our test offers, for example. And there are so many ideas and models how to do prevention that we have to exchange these models. And this is one of the basic ideas of the Fast Track City Initiative. And I like this idea to exchange these models on a certain level.
Thank you. Thank you very much. We are almost out of time, but before we close this session, I want to go back. Vinay said in his answer to my first question, the clock is ticking. And Cyrus said, we can win this challenge. But for each of you, given that the clock is ticking, we have the strategy, we have the global strategy, we have some EU instruments, suggestions we need more. But if each of you needed to identify a key next step to make sure that we really do make significant progress on this issue, we don't allow, as was expressed earlier, that some of the risks that the COVID pandemic have created of going backwards, we don't allow that to happen. We move forward with this issue. What of all the issues we've discussed over the last 50 minutes or so would each of you highlight as the key next step? And I'm going to go Jens, I'm going to go to Mario, I'm going to go to Vinay, and I'm going to close with Cyrus, one of our host MEPs. Jens first, in 1 minute, your key priority. You've muted yourself, Jens. Sorry.
My key priority would be to to work about bottom-up process that as I put before. So to hear the voices of the people who are living with HIV because they are the experts to their own disease, and to hear this voice to underline the JIPA principle and to take that very earnestly.
Thank you very much, Mario.
Oh, I must agree with Jens. Of course, my top priority is just about the same. That is seeing of greater involvement of communities in all the decision-making processes, which lead to policies, initiatives, which involve the quality of life of people living with HIV. Because they are the ones who know their needs, they're the ones who can provide information. And I think as we move towards this new normal, I believe that the concept of healthy living, healthy aging should guide us all in our daily work and at all levels, at policy level, at clinical level, and at community level.
Thank you. And Vinay, you talked about this much more granular approach that you're taking now. The key next step to drive progress for you.
Jackie, I'll be very brief. Two things. First of all, ending AIDS requires that we end inequalities. So we need to get serious about really ending and narrowing the gaps between different groups and different communities in how we make progress. Another very practical step is in the next month, all member states of the UN, including all EU member states, will get the new global AIDS monitoring guidelines from UNAIDS. And in spring of 2022, in the next 4 months, all countries of the world, including the EU member states, will be asked to submit a global AIDS monitoring report to UNAIDS. This is a critical opportunity based on the new targets, the new global AIDS strategy targets. How can member states really show that they're moving towards implementation? And for some, especially regarding the 95 targets, it's going to be an unwelcome or a frightening wake-up call to realize that many countries are not on track to reach these targets. And that will be an urgent wake-up call for all countries and all communities to really redouble their efforts to reach these targets by 2025.
Thank you very much. And Cyrus, you said we can win this challenge. Key next step to make sure that we do.
Yes, I think that when it comes to the European Health Union, we need to make sure that our voice is inserted in the big narrative of what needs to be done. But apart from that, we need to push for member states and for the European Union itself to take on board the mission, first of all, to eradicate HIV and AIDS. Secondly, to have those living with HIV given a full quality of life. And I think that we can do that. And this is what needs to be done at an EU level now in practice. And this can only be done by bringing everyone together to work on this. And
absolutely,
I'll be taking it on myself, on parts of it, to do that after this meeting.
Thank you very much. And thank you, Cyrus, for you, along with the other MEPs, for co-hosting us today. We're very grateful to you. Thank you, Vinay, for finding the time on what is a very busy day for all of you. I know we are very grateful. Mario, Jens, thank you for sharing your very concrete and practical experiences, because as you have said so eloquently, without you, none of this can happen, and you are at the heart of it all. So thank you very much to all of you. We are immensely grateful to you. We are almost at the end of our proceedings today, ladies and gentlemen, but our third co-hosting MEP has joined us now. Delighted to have her with us, Frances Fitzgerald MEP, who's a member, among other things, of the Committee on Economic and Monetary Affairs in the Parliament. Frances, it's great to have you with us. You were listening there to those final priorities for action that our panelists were identifying. Some closing thoughts from you before we end today's event, if you would.
Well, hello, Jackie, and good afternoon, everybody there. Still good morning, I suppose. But look, really delighted to be joining you today, and thank you for asking me to be involved. I've been working on the issues you've been talking about since I lived in London in the 80s, worked as a social worker there and saw the terrible isolation, stigma, and so on that, was prevalent at the time. So that was a fantastic discussion to hear. And, so much, Jackie, of what I heard there, I can absolutely agree with. I mean, the last macro point that was made about inequalities, that, and access to health. And I think COVID has given us a new lens, certainly in the European member states, in the European Union, in terms of, we can't do this on our own as member states. We really have to work together on health issues, whether it's access to drugs, the new pharmaceutical strategy, whether it's about sharing best practice. I heard you talking about best practice networks, whether it's about, you know, seeing initiatives in different member states that we can replicate it. I'm doing some work on care across Europe, and it struck me listening that actually some of the points I'm making in relation to the need for a care strategy across Europe, you can almost transfer them, not so much about caring issues, but about the kind of ways Europe can work together. It's about gathering data and information, how member states are dealing with this issue. It's about employment issues. It's about access to health, as I've already said. It's about who does the caring. There are, you know, similarities. We can take some lessons and use those across other issues, including HIV. The other point that came up very strongly, Jackie, is really the importance of working with those who are in the front line of this. You know, the experience of survivors, the experience of families. We've got to get that into policy making right across Europe. And we have to have a really good engagement with the NGO community. It's about building bridges between, you know, I often say when I was in government in Ireland, you think all the power is outside to a degree. When you're outside, you look at government, you say, oh, all the power is in there. I was in an NGO. It's actually about bridge building between the two. And I think we have to get more sophisticated in how we do that. I mean, I'm very happy, you know, to be speaking at this point of the conference, because this conference is, it's about going beyond the traditional focus on viral suppression, and it's about meeting the long-term needs of those living with HIV. And I think what we're seeing today is that it is time for a paradigm shift, a complete paradigm shift beyond viral suppression. It's action, you know, and it's about dealing with the current issues. And I think today's conference is an important step in that direction for policymakers as well. And we have to highlight the issues that have been raised by the speakers. And we must look at stigma, discrimination, and comorbidities on the well-being of the HIV population. And that's very broad, as we know. I mean, I would include housing, for example. We're increasingly discussing access to housing across Europe. That's become a real issue because we know that HIV can impact on employment, opportunity, and choices. And therefore, housing can become an issue as well. So after 40 years, we should not be neglecting all of these, as you said earlier, quality of life, quality of health issues. That's where the focus has to be. And I mean, in my country, for example, in Ireland, we have over 7,000 people who are living with HIV, and they count on us to start living well. And not just for how long they're going to live. It's quality of life issues. So I think Europe can do a lot. You've heard from one of my colleagues about some of the initiatives that we can take. Let me add in two other points that Europe is working on at the moment. I'm on a committee on disinformation. You know, we have a huge issue about the spreading of false information. And this was right through this whole epidemic, COVID, and previously AIDS, HIV, we had false information. And again, I think this is something to be really combated throughout Europe. We have a new report coming on that, and also new initiatives on hate crime and hate speech, because they have not gone away. We're seeing incredible discrimination in some member states at present, for example, Jackie. I mean, you look at some of what's happening in Poland and Hungary, and I cannot believe that we are seeing the discrimination against the LGBTQI community, for example, that we are seeing. It's very disturbing. And the European Parliament has been very active in, you know, calling a halt to that. But it's surprising how strong it is and what authoritarian governments are doing. So that's, you know, very serious. And let me quote one other statistic. In 2018, only 5 out of 48 countries across the broader Europe reported that they included quality of life in their HIV monitoring. So, I mean, that's where we're at. There's a huge amount of work, you know, is still to be done. So they are the main points, Jackie, that I would make at this stage. The reality is that, you know, HIV is still with us, and we have to consider very carefully the needs of those who were first diagnosed. And I mean, some of what happened during COVID, like the closing of clinics, for example, is very disturbing. STI testing centres, we've some appalling things. For example, clinics only accepting people for testing when they started showing symptoms of HIV. I mean, this is an issue. How do you keep all health services going at the same time as we have COVID? And COVID is going to be with us for quite some time. So, I mean, Mike Ryan of the WHO noted that urgency in a pandemic is key. Perfection cannot be the goal, but acting at all, even if not exactly in an ideal way, is better than nothing. And I think as we move forward to living with COVID approach, we know that these clinics are absolutely critical. We've got to make sure that people still have access to the health services that they need and that there's enough staff. So I think that many lessons from COVID and many risks associated with COVID for the community as well. But all in all, I think, as your previous speaker said, you know, a very challenging, but a time for opportunity to really move forward in terms of the challenges that HIV presents. And I think we've really got to get the member states monitoring properly and taking note of these international tools that are now available and required of the member states. So I hope that gives some pointers, Jackie, in terms of where we go from here. But a very exciting discussion, I think, in many ways. And it's still about pulling back the curtain, you know, it's still about pulling back the curtain and talking about all of these issues in a realistic and practical way.
Thank you. Thank you so much, Frances. And thank you, as you say, a time of opportunities and with the commitment of you and our other co-host MEPs today, commitment to address these issues, these very difficult issues we've been talking about. We're very grateful for your support for this event, your support for HIV outcomes. Thank you to all of our speakers for identifying how we can make the most of that time of opportunities and meet this challenge and really make sure that we deliver significant progress. It's been a moment of reflection and celebration of the progress made, but also of the challenges ahead. And thank you for those very valuable insights from all our speakers throughout the morning. And finally, thank you to all of you for joining us for this discussion. It only remains for me to wish you all a very pleasant rest of the day. Thank you and goodbye.